My next guests have a deep understanding of our healthcare ecosystem and its infrastructure. I'm delighted to have them on to discuss not only the resiliency of our pharmaceutical supply chain, but also their recommendations for a seamless rollout of the coronavirus vaccine when it becomes available. Dr. Elena Rios is the president and CEO of the National Hispanic Medical Association. Dr. Joshua Sharfstein is professor of the practice in health policy and management at the Johns Hopkins Bloomberg School of Public Health. And Heather Zenk is senior vice president of strategic global sourcing at AmerisourceBergen Corporation. Thank you all for joining us. Heather, let me start with you. I think one of the reasons we're doing this program today is that Americans are anxious. They're anxious about what's going on in the country, the stress out there. They're anxious by what they've seen with regard to some of the management of, PPE in the past. And there's concern about how a virus vaccine is going to roll out and the various therapeutics for it. So I guess my question to you is just take off the corporate hat for a minute, but should Americans be anxious about some parts of this, or should they have confidence that the system is going to work?
I think Americans should have confidence the system's going to work. We have lifelong medical staff. We have lifelong resources that have done this kind of work over and over again. I think what is unprecedented, which is another term we use very frequently during these times, but truthful in this example, it is unprecedented that we're looking to vaccinate the entire United States population in a short amount of time. I think with that unprecedented effort comes a strong supply chain that wants to support it. I think you have healthcare professionals. We all want to get back to more of a normal lifestyle. I want to see my family. I know many of us would enjoy spending the holidays together, which may not happen this holiday season, but let's look forward to next holiday season. And I think what you need to rely upon here is you have a sophisticated, robust supply chain that can do this in the United States. And I think what some of the uncertainty is coming around is now we're hearing there's ultra cold temperatures, we're hearing frozen temperatures. Those aren't something that we typically deal with in the supply chain on a daily basis. Outside the norm, but not daily. And I think when we're looking at vaccinating the entire United States, we need a robust plan. We need people that will raise their hand to want to do this, which I think you have a willing healthcare supply chain to do this. It's just a matter of becoming collaborative together, communicate amongst each other, and then let's execute on a plan that we can all agree upon in order to get the vaccine to patients. Not just to approval, but to patients is what we need to focus on.
Thank you. Dr. Sharfstein, I think one of the realities that we're seeing is that we're seeing incredible time pressure put on science, put on the industry, put on the innovators that are out there trying to both discover a vaccine, but then manufacture and distribute it. And at the same time, we see a lot of politicking. This is a time, of an election. And there are concerns really about trusting the science. Is science being able to give the leeway it needs to produce what it should do? Or are we taking shortcuts? And I know you have thoughts on this, on pressure on the FDA and others. But I guess I'll ask you a similar question. Is should we all be able to trust what's developing?
Well, I think trust comes from expertise, knowing that people who know what they're doing are really making good decisions. It comes from data. It comes from transparency. It doesn't come from political interference that undermines trust. So I think we're poised to have a safe and effective vaccine. Really depends what the studies show. I think we're poised to have a good review process at the Food and Drug Administration with an independent advisory committee weighing in on the data and a lot of transparency. And we're poised for the agency to be explaining itself to the public about who should be getting the vaccine, and for advisory committees at CDC to weigh in. So I think that the pieces are moving into place, but those pieces could get knocked aside. And I think it's very dangerous when the president, accuses people at the agency of not moving fast enough for political reasons. In that case, I think he's really doing a lot of damage. He's making people see the agencies as primarily political, when really they're moving at the speed of science.
I would like to ask all of you, when I go to Elena, when the early stages of this virus were coming out, and we were every day, I was doing a show every day on where the tests were. Why didn't we have a national testing plan? And you get down to it and you go back and sort of look retroactively, and a lot of dysfunction between things like the FDA and the CDC. We also saw this virus, both in infection rates and mortality rates, hit parts of this nation in uneven ways. And the Hispanic population, the black population, took on a huge burden. First, frontline workers. And so again, I would come to you and say, what needs to be put in place so that we have a fair, just, even, solid response on COVID-19 that, along with supply chain, everything. I mean, I know you've been working on this. So what matters most for you and your community?
Well, two things. One is you have to have the data. The data collection by race and ethnicity is really important. And in our healthcare system, it's hit or miss. It's been optional. It's never been mandatory. And for an infectious disease of this magnitude that is harming and burdening all of America, but especially hotspots like African American, Hispanic, Native American, poor communities, rural communities, it's important to have that data identifiers. The second thing I think is it's important for people to realize people that live in the United States, even if they're not documented, need to be vaccinated. And we need health access big time in our communities. Latinos in this country have not applied for government programs. They mistrust government programs. So there needs to be messengers, the physicians, the nurses, the frontline workers in our healthcare system, our nursing homes, our community-based organizations. We all need to work with the public health agencies, and we need leadership that looks like us in the public health agencies and in our healthcare systems to be able to have more trust and to get the campaigns to our communities through the media and social media that we're already doing. We've been doing this all year. I think it's important to realize that a lot of the organizations that are healthcare related have jumped on the bandwagon to help.
Thank you for that, and we'll see how this rolls out because I'm really interested in what kind of vaccines we're going to get. Josh, I don't know if you've been following. I kind of watch this grid, and I look at the various companies. There's some big pharma companies, some small pharma companies. They have different approaches, mRNA and DNA and others, and sort of, there are different phases in trials. CEPI funds some of this, and, DARPA, or not DARPA, but Operation Warp Speed with some of the manufacturing.
Right.
When you kind of look at it, and you look at that lineup, I don't know who's going to get over the line or what the differences come in. But can you just take us down the track for a minute to explain when we're going to be able to see a vaccine sort of in the marketplace for regular folks and how that's going to be tiered between those who most need it versus not? And how are we going to deal with multiple vaccines?
So I think it's important to see this as, a series of stages. And you have to get past one stage for the next stage to even matter. And right now we're at the stage of getting data from the clinical trials that are going to tell us whether the vaccines are safe and effective when used in thousands and thousands and thousands of patients. And they're going to look to see whether people who got the vaccine are much less likely to get COVID than people who got a placebo. And they're going to look at safety data to make sure that the vaccine, doesn't cause any untoward side effects in that group that got the vaccine. Only when we know that can we get to the next stage, which is starting to think about who should get vaccinated. And not all the vaccine we'd like is going to be available right away. So there'll be a couple phases. In that first phase of vaccination, it will be people who are likely healthcare workers and people at very high risk for getting the coronavirus. And states are going to play a really important role in distributing the vaccine in collaboration with a bunch of different partners, including in the private sector. And then behind that, we're going to see a lot more manufacturing. Now, hopefully more than one vaccine will prove safe and effective so that we'll have multiple vaccines being manufactured. And I think in terms of the, could grandma be getting the vaccine? That may be a question for January, February. What about everyone else? That may be more of a question for the late spring or summer. But and that's if everything goes well. If those first phases have challenges, then everything gets put back. But to be in this position is a lot further ahead than ever before.
Well, Josh Sharfstein, I know you have to leave. I want to thank you for joining us today. I'm going to jump to Heather for a moment and ask her, when we talk about what our experiences were in the past, we had 150 million or so vaccinations of the flu in the last year, and then adding another 150 million on top. How does that work? Is the system able to carry that load?
The system is. I think the commercial supply chain is really built on efficiency and scale. So as long as we can do a repetitive activity, success will happen. I think to Josh's point around the phases, that will also play into how the distribution of this works. So to add into the COVID vaccine into the statuses of traditional vaccines and also flu vaccine at this point is going to follow the stages. And to me, there's two kind of supply chains in the U.S. today. There's the public health supply chain, and then there's the commercial supply chain. And I think particularly when we add in the COVID vaccine, that's the time to really rely upon all of the entities that can vaccinate in our supply chain, such as pharmacists, such as physicians in independent channels. We have the ability, and at times we do tend to rely very heavily on the public health supply chain in order to vaccinate. We're going to need to use all of the supply chain, both the public health supply chain and the commercial supply chain, to make this happen. But from a distribution point of view, scale, efficiency, effectiveness, that's our bread and butter. That's what we win off of every day, and that's what we build off of every day.
Before we jump back to Elena for a minute, I want to ask you, there's this COVAX coalition, that's a global. I think there are 184 countries that are now members of it. Every other nation, they're kicking money into it. The United States is not a member of that. And I've interviewed the Minister of Health in Sweden, who said, she's really worried about vaccine nationalism. And if America, which is such a big innovator and such a big part of the puzzle, isn't part of that, she's worried about a kind of law of the jungle out there. Are we worse off by not being part of COVAX? What are the implications of that?
Personally, I think, collaboration is the best way to go about this. We're in a global economy. We're in a global supply chain. A lot of the pharmaceuticals are started in other countries, finished in the U.S. here in FDA-approved sites. We do need to think globally, but we need to act locally also. So I think us looking internally to understand how do we protect our healthcare workers, our highest risk, then roll this out. I think it would be beneficial if we would join that coalition, but we would also think about the global aspect. We're in a global pandemic. We're not in a U.S. pandemic. We're not in a Sweden. You mentioned Sweden, Swedish pandemic. We're in a global pandemic. The global economy does need to come together, and the global healthcare system needs to come together, just because we have so much movement between countries and so much movement between continents.
Well, thank you for that. I should mention, as I jump over to Elena and ask her, about how we get this equation right, I do want to give, the U.S. just this past week committed to give funding and support to CEPI, the Coalition for Economic Preparedness Innovations. It's about $20 million, which is a lot to some, but a drop in the bucket, frankly, compared to many countries that are giving there. So there are some coalitions the United States is a part of. But Elena, to come back to this question of when we see a rollout of vaccines, I interviewed Dr. Robert Redfield of the CDC, and he made the same point you did. He said, we're going to have to embrace a person without resources, a person who may be homeless and without shelter, contacts who may be exposed. We're going to have to find a way to bring that person into being tested, if infected, give them, support and treatment. And otherwise, the system comes apart. And so I think what Heather just said about the global dimensions is so important. There are going to be parts of the world that are hard to reach. How can we, you're thinking about this a lot more than many of us are. How can we not just be philanthropic, but actually be committed, like our lives are on it, to make sure that we're inclusive as we reach out to the community that needs it?
I think one of the most important things the whole supply chain, every step of the way, can do is to think in terms of family-focused effort, not just individual effort. So the whole family needs to get vaccinated. The whole family needs to understand that what they're doing by getting vaccinated is helping other families. And then the families translate into neighborhoods. And if California has a whole health equity lined up. CDC has hotspots all over the country. There are neighborhoods and census tracts that can be focused on with the essential workers, the health workers, as well as those who are most vulnerable with chronic diseases already. And those people need to be protected first, as the National Academies of Medicine and Science, Engineering and Science have said, for their distribution plan. But I do think that there's an important role for commitment on through media. We have a lot of people get information not only from their providers, but for those who don't go see the doctor or don't go to the pharmacies to pick up medications, they get information through the media. And we have ethnic media that are mom and pop type newspapers, magazines, and then of course, you know, the national networks in the Spanish language and other language, Asian languages, for example, have their own media stations, Univision, Telemundo, that really need to have the same message and work together with the Ad Council and create a major focus on the importance of vaccine. And I think we need to start now with the flu vaccine season upon us and the importance of getting involved. We're involved with the flu vaccine distribution messages with some of our partners and of course with CDC.
Well, I really appreciate, I think that, Heather knows this business inside and out, knows what's out there. And one of the things is, as I've done a deep dive into it, you realize how complex I don't know whether to call it the backbone, the circulatory system, the tendons of the, supply chain is incredibly impressive. But I have to say, even with the concerns people have, I was very ignorant of a lot of what is out there and have tried to inform it. And so we have a big way to go when you think about the media and what we need to know, but others in terms of what that is out there and who the right messenger should be. But we've been taking questions from our audience, and we have a question from Daniel. Daniel?
Hi, my name is Daniel Hartnett. I'm Associate Managing Director, Kroll, Division of Duff & Phelps, based out of Reston, Virginia. My question today is, how do we ensure the integrity and the security of the COVID-19 vaccine supply chain? Namely, how do we ensure that various adverse actors don't slip into the end-to-end supply chain, be it from a security, theft, tampering, fraud, cybersecurity, and various other security-related perspectives? Thank you.
I want to get both your views, but let me start with Heather. Because this is a big deal, right? We're talking drugs today, like pharmaceuticals and therapeutics. But when you're trying to get a mask, I used to go on eBay and just see ridiculous things going on there. So how do we enhance and amp up security in our supply chain?
Well, one thing I think, if you're a patient going to get a vaccine, trust your local healthcare professionals that you always have. They then trust their supply chain partners that they've always used. As long as we continue to use the resources that we've used over the course of time, that is one, know your partner, trust your partner, validate your partner. The second thing is to be logical. I know that the CDC and Operation Warp Speed is treating the vaccine development and where the vaccine is being stored and how it would be disseminated as a national security event. They are taking it very seriously around the transmission of it. And I think it's a wonderful question and something that we don't always think about. We also, over the course of time, we don't always publish where our distribution locations are and where we have pharmaceuticals, just out of safety and security of our associates and our associates that are picking pharmaceuticals every day. And that's the same practice that I know my colleagues in this same space in the pharmaceutical supply chain also take very seriously. Really, it is, I think one of the key things is know your partner, know who you trust, and only do business with whom you trust at this point also.
Elena, how would you approach that as well? And thank you, Heather. Thank you, Daniel, for the question. But how do you approach the security? Because I think it's amply important for communities that already have a trust challenge, who don't see folks like them in the messaging. So, so one is perceived risk and the other is real risk. But your thoughts?
Yeah, the perception is very important. I think, everybody's talking about anti-bias training and the importance of having equity and inclusion. But I think what really matters is the messenger. And I have to, applaud what Heather said about trusting your own provider, making it local, so that people can actually see who they're talking to. Trusting the federal government needs to have a face. And that was the whole, I think, part of the problem with this year's misuse of information or misinformation, I guess, is that the CDC is the public health department. And the CDC needs to be out there. The CDC, the public health agencies of the state governments, the local governments, working together with the faith-based, our religions are very important to our communities of color. and community leaders, community organizations. I think we do need to have a face and messengers lined up, a speakers bureau, if you will, of the importance of vaccines for COVID-19, since it's such an infectious disease. And
Well,
I
look,
think the people in our communities need to understand that it's a very serious disease and how important a vaccine is to the decrease in the infection rates in our own families and communities.
Well, look, I realize that this is a complex time and a stressed out country, a lot of choices. I really appreciate your thoughts on how we do this right, because I think there are choices out there. I also think that there are unacknowledged strengths out there in the supply chain and the medical chain that we haven't been talking enough about. But I think that no matter how this election turns out, it's something we're going to have to get our heads around. Rolling out vaccines and therapeutics in the right way. I really want to thank, he's not with us right now, but Joshua Sharfstein of the Johns Hopkins Bloomberg School of Public Health, Heather Zenk of AmerisourceBergen Corporation, and Elena Ross of the National Hispanic Medical Association. I hope you'll be back, because this is going to be a story that we continue to cover. So thank you so much.
Thank you.